Good evening, everyone. Thanks for tuning in to another edition of Let's Talk Donation with Gift of Hope. I'm your host, Olivia Fox, and this is an interactive show where you, the viewers, can call in and ask any questions that you might have about organ and tissue donation in our community. As we are each week, we are streaming live at cantv.org/hotline, and you can call in and join our conversation by dialing 312-738-1060, and that number is right at the bottom of your screen. If you would like to ask us a question and a question of my very special guest for the evening, make sure to get those calls in before 6:50 so we can make sure to have time to answer your question thoroughly. So I know you all have been hearing the commercials and the conversations, and we're like, talk donation. What type of donation? What's this all about? Is it donation to education, donation to charity? What is it? In actuality, it's a little bit of both. It is education about organ and tissue donation, as well as charity to your fellow man, woman, and child. Each week, special guests and I have conversations about the importance of organ and tissue donation, and especially what minorities need to know about participating in the process. Ultimately, our sole goal is to give you enough information to dispel the long-standing myths and misconceptions that run very deep throughout many communities, while helping our viewers to understand that Gift of Hope is a very reputable and trusted partner in the community. We recognize that minorities have fears of healthcare entities, and some of it was well-founded. However, for the last 30 years, with advances in modern medicine, our hospital and religious partners, community partners, Gift of Hope has helped turn tragedies to triumphs through organ and tissue donation, while supporting our donor families, those waiting for a transplant, and those who have received one as well. So welcome to the show, and we'll be right back after our regularly scheduled commercial break, and you'll see my special guest for the evening.
Nikki's donation has made a huge impact on a lot of people. This one right here, sitting next to me especially. When Gift of Hope came to me and asked me for the donation, it made me feel very confident knowing that I can give my baby's heart. This is Nikki's heart beating inside Tanisha's chest.
So when I heard this pounding, like, what is that noise? And the nurse said to me, that's your heart.
I carried Nikki for 9 months. Now Tanisha's gonna carry her the rest of her life.
Say yes to donation. Start the conversation with your loved ones today. Welcome back to the show, and welcome to my very special guest for the evening, Dr. Enrico Benedetti. Welcome, Dr. B.
Thank you for inviting me. My pleasure.
Dr. Benedetti is a professor and the head of surgery and the Warren Cole Chair of Surgery at the University of Illinois Health Systems. So he is the head transplant surgeon over at UI Health, and he is very involved throughout the transplant community. And I'm so excited to have him here to talk a little bit about transplantation in our community, what people that need to know that are waiting for a transplant, and what maybe people that even have received a transplant need to know that might help improve their quality of their new life. So I'm so excited to have you here to talk about that. And also, just a reminder, if you guys have any questions or if you want to reach out to Gift of Hope, you can reach us at giftofhope.org, or you can reach me at my personal email or my Gift of Hope email, ofox@giftofhope.org. If you have any questions, want to get involved, or even if you want to reach out to Dr. B after this show, please reach out to me or to us at Gift of Hope. So let's jump right into it, Dr. B. What in the world made you want to become a transplant surgeon?
Well, I trained in the University of Illinois since 1989. And my dream was always to do organ transplant.
Wow.
I immediately thought it was the best way to spend my career. And there is a mix of surgery as well as medicine that make the job always new and interesting. I witnessed in my 30 years career many improvement in immunosuppression therapy, improvement technical, and transplant has been always at the forefront of innovation. And plus the human side. I mean, you really make an impact to people that, thanks to the work of a team, of which the surgeon is a part, can really have a second chance of life. There's sometimes really life-saving organ, always improving quality of life. So it's been a formidable experience over the year.
Absolutely, and that is so amazing because like we said in the intro, this has only been around for about 30 years. So, to know that you've been involved for so long makes me understand even more that you're really a pioneer in this industry, and I'm so honored to have you here tonight to discuss all of this stuff about kidney transplants and transplant patients in general. So I know a lot about the statistics from the Gift of Hope side, but often our viewers and what we like to discuss a lot of times here on this show are the disparities regarding minorities in transplantation. And again, with the outreach that I do, I'm aware of, also with being a recipient family, I'm aware of how difficult it is as a recipient, the things that a recipient, or someone that's waiting for a transplant, the steps that they need to go through. But can you tell us a little bit about, are there still disparities in donation? And if so, what are some of the reasons for those lasting disparities? Because there's been a lot of advances that have helped things out a lot.
Well, I believe that the federal government, UNOS, and various organizations have done a lot to try to regulate the field in a way that doesn't disadvantage anybody. For sure, minority, I have a lot of knowledge since the University of Illinois serves mostly an inner city minority population. 55% of our patients are African American,
Absolutely.
30% are Latino. The minority are actually mainstream.
The patients
Caucasian.
reflect the community.
We do reflect the community, and of course we have been challenged mostly not so much by the general rule, but other factors. For example, African American have double the risk of renal failure than any other race. So if you confront the pool of the donor and pool of recipient, you find some discrepancy. I believe that currently the main hurdles are not so much legislation and rule for organ distribution. It's the fact that very often minority patients have comorbidities. For example, high body weight,
High
obesity,
BMI.
high BMI. A lot of programs are reluctant to transplant, for example, African American women that have a risk of 50% while on dialysis to be overweight.
Right.
30% of the African American male are overweight with IBMI. So these are people that have all the right to receive the optimal treatment, which no doubt is transplant as compared to dialysis. But many centers are not willing to give them the opportunity. That's
We
why
say those are the more conservative centers that are...
I think center also need to follow some general guidelines because, of course, if you have a poor outcome, the federal government will intervene and penalize the center. So
kind of get like a little ding sometimes.
Exactly. I'm not criticizing anybody. But, of course, taking patient higher risk sometimes will make your result less than perfect. So some people are reluctant. We've been actually, I would say, a pioneer in using robotic technology to overcome the risk of surgery for morbidly obese individuals. We have done today 250 cases, all in IBMI patients with splendid result. And I think we have made a difference.
And so if you can break it down a little bit. So we discussed that the high BMI is one of the things that causes people to get turned down from certain transplant centers. Can you help our viewers understand a little bit why the belly fat is kind of a barrier in doing this surgery and how this robotics process that you mentioned, why that makes the difference?
Yes, so the general result of a standard open transplant in obese individuals are not as good as people that have optimal body weight. Okay. That's a fact. And the main reason is the fact that patients with IBMI have a higher risk of wound infection, which is as great as 30-40%, the BMI of 30-40.
Okay.
So as a consequence, when they have the wound infection at a higher rate, they do worse. Even patients at normal weight, if they have wound infection, do worse. So the robotic technique pretty much in our end has eliminated wound infection. And as we expected, and now we have 1 and 3 years data to prove it, we have better results.
And it seems like that's a little bit of even a less invasive process. I mean, a less invasive way to do the surgery. I mean, surgeries that have become so standardized have become standardized because of the use of these robotic technologies. For example, like an appendix surgery or something like that has been made so much more common and easy to be done because of this robotics technology. So it's the same Same kind of principle
I think
implemented.
so, because you see, if you do the typical incision that work very well for a patient with normal body weight, this is the same operation was done the first time in 1954, has not been changed. It means that it's good, right? It's hard to improve on somebody with normal weight from open surgery, but for patients that are obese, and the fat, as you know, is mostly in the lower part of the abdomen, you have a terrible complication rate in terms of wound infection. We just need a small incision in the upper part of the abdomen to insert the kidney in the abdominal cavity, and then we suture with a robotic technique through small hole. So less pain and suffering, a rapid recovery.
Absolutely rapid recovery. I was just going to say, I know a lot of your patients that have been up and out after the surgeries, I mean, less than a week. I can, again, say that because I've seen that from personal experience. So it's making the biggest difference. And again, it's really pioneering a process in this industry. And it's amazing to be able to watch you do it. So back to waiting patients and patients that maybe are concerned about the process of transplant. What are some things that, let's say, a dialysis patient can do to be more transplant ready or to become more transplant ready? Because I saw what my mom had to go through, all the appointments that she had to go to. You know, she had a renal diet that she focused on, and she was able to kind of leave work and make that her main focus. But I know that, do you think that that's a cause of why some people have a hard time getting transplant
I
ready?
believe that, of course, the patient initiative and the degree of support from family and community make a big difference. And I start saying that although I applaud all the effort to increase the pool of cadaver donor, we shouldn't forget that the best result in kidney transplant are obtained through living donor. And living
Interesting. We
donor
talked about
is,
living donation in the season.
is not something that, for example, African American community will
Knows
not
about.
support. They support a lot. I would say that I have a long-term experience. African American families are very generous. They want to help. Unfortunately, sometimes they have the same comorbidity that led to the failure of the kidney in their
So maybe like the diabetes or high blood pressure.
Absolutely. But it's not like they don't want to do it. And about 25% of our patients end up with a live donor, which is superior survival for patient and graft.
And that also makes it so that a person doesn't have to wait that 5 to 7 years on that kidney list.
Absolutely. It's 2 to 4 weeks in a good well-structured program. But I would also spend a few words reminding patients that are waiting that an important component of their health and a way to fight the risk of death that is present on dialysis is maintaining fitness. Dialysis, unfortunately, chronic renal failure is a major cause of loss of lean muscle mass. And we know for sure now that the people that have lower muscle mass are the ones that are more likely to have complications, even dying. So,
and you know, we've actually talked about dialysis on the show before, and we talk about how dialysis centers are popping up on corners, you know, on every corner in minority communities, and that this is an epidemic that we're seeing. But we also talk about that dialysis is not the final, it's not the cure. And a lot of times in these communities, people get into a dialysis center and they have that schedule, and that's just what they assume that their life is supposed to be. They don't, realize that transplant will give them a new quality of life. But like you were also saying, that dialysis is breaking that body down, which is making it less prepared for transplant. So it's like a hard space to
and
figure out.
The reality is that the 5-year survival of an average patient on dialysis is 30 to 40%, meaning is more fatal than many cancer. And it's fascinating that this information is not always available to everybody.
It's not.
Clearly, if you're challenged with this information, you want to have a transplant, at least be considered for one. Because a successful transplant will bring up your chance of being alive at 5 years to almost 90% nowadays. So there's a huge difference.
Good chances. And like I said, that's dialysis is not a cure, and it's not where you should stay forever. So
No, it's a great technology that has allowed people to survive renal failure, and I have the
Absolutely.
utmost respect for dialysis and doctors that do dialysis.
absolutely.
But the patient should also have other options, no doubt.
There should always be other options considered. You, as a patient, you have to be your best advocate. If you have a loved one that is going through this, you have to be an advocate for them and help make sure that you are figuring out the best strategy for them. Because depending on the person, the strategy might be different, or what treatment plan they figure out is different per patient. So it's definitely important to consider and remember as your own advocate, and if you are a family member advocate for someone. So after someone has a transplant, people might think, oh, I'm going to have to be on, all these medications for forever, or I'll still be sick, or I'll have to go to the doctor all these times. What are some ways that patients can have a really successful post-transplant experience?
I would like to answer in two ways. Number one, the patient after transplant is the essential element for success. Only patient that can follow medical advice, take the medication precisely, will succeed. Compliance is everything.
Compliancy, yes.
But the other thing that I like to highlight, as I said, I've been doing this work for almost 30 years. And I noticed that many patients, after transplant, when everybody expects them to do great, do not function well. They're still weak.
Still
they can
not able to
hardly
work.
get out of the house. They cannot even go grocery shopping. And I've been thinking for many years how to help them, because it's not generous to have all the attention on them as the transplant takes place. The donor maybe come in, all the doctor, all the nurse, all the family, and then a month later, oh, the creatinine is normal, you're okay, goodbye. They still need help. And I've been very pleased with the program that we start that is aimed to improve the strength and the physical fitness of our transplant patients.
Absolutely. I think you're talking about the GH Fit Lab program, right?
It has been a great success.
It
It's
has.
been such a great story. I mean, 75% of the patients that complete the 1-year exercise program went back to work.
My mom is one of those
God
numbers.
bless her. Of course, that's the final measure of rehabilitation. Going back to work is the final measure of rehabilitation.
That's what everybody wants to do. That gets back to that regular quality of life, or more normal quality of life. That's what you want to do. We don't go through, like you said, you don't go through all this to just do the transplant and
Vegetate,
that's it.
right? You
and
want to
vegetate.
live.
You want to live. You want to continue to flourish. You want to be able to continue to honor that donor's gift, to be able to travel and do amazing things. That's the whole purpose of
Absolutely.
transplant and donation. So with the GH Fit Lab program, so one would wonder, how can someone that is a, post-transplant patient, how can they be in a gym and working out? Like, that seems intimidating. I remember that when my mom got better, and I was in like a kind of a fitness kick, and she's like, well, I want to get back to the gym, but she was feeling a little like, well, I'm intimidated by, other people in the gym. I'm also a little nervous about what I can do. I don't want to do too much with my new transplant, but I do want to try and get stronger. And so luckily you had something in store for her.
She's a success story. We're very happy for her. Pretty much the GH Fit Lab take people that are weak and that have really not much strength at all. So they go to the level that they can work, and is a resistance training with weight. They go to the minimum amount of weight that they can lift.
Minimal. We're talking like, 5 pounds, maybe 3 pounds at a time, whatever is minimal for that patient.
And it's
We're
only
talking very minimal.
twice a week, 1 hour training, but we have witnessed the ability of lifting weight going up 4-fold, 6-fold by the end of the year. And as the body becomes stronger, the patient becomes more socially active, is less depressed, and all of a sudden they don't want to be on disability. They want to work and make their own money, right? And they become part of the society, they become employed. Again, 75% versus 10% of the control went back to work.
So it's almost like completing that last piece of the puzzle, with this whole donation and transplantation thing, to be able to completely and fully rehabilitate that that recipient.
Absolutely.
And that seems like it would even help them continue to be strong, and continue to live a healthy life that, maybe they didn't know how to live before,
But isn't it the essential step?
It is. It's the essential
It's
step.
the essential step if you want to achieve a full rehabilitation. And so, as you know, we have been fortunate that some philanthropic donor has allowed to do this work, that is God's work, with their support. But of course, my long-term plan is to bring these extraordinary results to the attention of decision maker, policy maker, to see if we can actually make that available to everybody that needs. For sure,
Absolutely.
patients that are deconditioned, that are weak, they should have access to that. It's better than any physical therapy that I witnessed in 30 years.
Wow, and that's amazing. And one thing I want to say about this program, I've seen people working out in this program, and when I tell you they don't sweat, I don't know how they go to this gym and they don't sweat, but they completely are able to be rehabilitated and, like you said, return to work. And so with this program, it seems like what it's able to do for people would be helpful in many different ways. So do you have a vision of expanding this besides, once you do get to, take this step to legislation and get it off for post-transplant patients? What are some
Well, I think
steps beyond that?
It's a great question, which I love to answer. We have now started a pilot study of 10 patients that are on dialysis.
Wow.
And we deliberately pick patients that are wheelchair-bound, that cannot walk, that limp, people that really cannot get around.
And those patients also are often those patients that might have been considered high risk.
Of course,
Yeah.
you're absolutely right. And for the study in transplant patient, it took about 6-7 months to see, you have the experience with your mother, it takes that long. And then at 12 months, they really flourish.
Right.
For the dialysis patient, at 3 months, we have seen extraordinary results.
Wow, even shorter time.
In 3 months, they go from the wheelchair to walk.
Wow.
And one of the patients that was rehabilitated after underwent a transplant, and although she was relatively old and overweight,
Wow.
she had a very smooth course. She went home in 4 days.
Wow.
So I think that's the way to do. And dialysis patients benefit in an even more spectacular way of the training compared to transplant patients.
And to me, it even seems like even if they continue to be a dialysis patient, if they were able to be stronger and be on dialysis, that would even improve their, chances of success and amount of time that they can spend on dialysis.
This is a very wise comment. And of course, we will do a larger study. We are fundraising. We will do 100 patient enroll in the exercise versus 50 on control. And I'm anticipating that I will see a survival difference. So we are talking about life and
I'll be
death.
looking. Life and death. This is amazing. And like I mentioned in the intro, there have been so many advances in modern medicine that have helped this process be more available and more equitable for everyone. And this continued research and studying is just going to continue to make this process better for everyone, better for minorities, better for everyone in our communities. And I'm just so lucky to know the person that's at the forefront of it. So this has been such an excellent conversation, Dr. B. I know I'm going to get flooded with interest and questions of people that want to know how to get involved. So please, again, if you are interested in becoming a donor, you can reach out to giftofhope.org. You can go to our website, giftofhope.org. It takes just a couple seconds to register to be a donor, to leave a legacy, to save a life in this way that we have been discussing this evening through donation and transplantation. If you have any specific questions or have any more specific questions for Dr. B or want to reach out to him or anything at all, please reach out to me at ofox@giftofhope.org. And again, if there is one thing that we can ask you all to do is please just have the conversation with your loved ones about donation, about your wishes, about the type of legacy that you want to leave, and it'll make things so much better for everyone. So this is our last show for the season, so we won't see you guys for a couple months, but thanks again, Dr. B, for joining us and for giving us so much good intelligence on donation and transplantation. And
Absolutely, my pleasure.
we will see you all next season for another edition of Let's Talk Donation with Gift of Hope. Happy holidays, everyone.